Welcome to everyone, and thank you for joining the very last session of the Value in Health Week. I would just like to initially mention that we won't be taking questions today, but please still do post them and we'll provide a written response in due course. On the session with me today, I have a few members of the Value in Health team. They are Lowry Syra Parfitt, Project Manager, Sally Cox, Principal Specialist Information NWIS, Lisa Powell, Head of Business Intelligence Financial Delivery Unit, Kathleen Withers, Principal Evaluation Specialist Cedar, James Griffiths, Senior Value-Based Healthcare Project Manager Shared Services, Denise Puckett, Head of Health and Care Engagement Life Science Hub. And last but not least, Dr. Sally Lewis, Head of our Value Team, National Clinical Lead for Value-Based Healthcare in Wales. Well, what an exciting and enjoyably exhausting week we have had. I'm not sure if some of you are aware, but we originally planned to run a nationwide conference and an international conference this year. And for obvious reasons, this could not go ahead. 6 weeks ago, we decided to run a virtual conference, and here we are. We have run 25 sessions this week with 56 speakers. So I'd like to thank all the speakers for their very informative presentations and for doing so at short notice with the challenges of doing such from our home working environment. I'll just say children, animals and dodgy Wi-Fi and say no more. We have had over 2,000 attendees at sessions with anything with up to 192 attendees per session. For those of you who have joined our sessions, thank you all for your enthusiastic questions, comments and engagement we have received so far. We will aim to get back to everyone regarding questions and answered over the coming weeks, and recordings of the events will also be available on the website in the next week or two. We will be sending out an evaluation to your email address later. Please do help us by sending your feedback, as online events like this are never easy and we have many lessons learned from our first attempt. We would like to make sure any future events are really tailored to what you would like to know, including things that worked well and not so well. We've also launched our website this week. There is a lot of content already, but we'll be publishing more and more over the coming weeks. And on that note, I would like to pass you over to my colleague Lowry, who will introduce herself and tell you a little bit more about her role in the website.
Thanks, Amanda. Hi, everyone, and thank you for joining us on a Friday afternoon. As Amanda said, my name is Lowry and I am one of the project managers in the Value in Health programme. My role alongside Amanda and Sarah, who are the programme managers, is to support, advise and facilitate the implementation across health boards in Wales. This mostly involves being the on-the-ground people with the services who want to begin or expand their outcome collection, and we support the practical implementation of this, which aligns with Goal 3 of the programme. Our role also supports Goal 4 of the programme, and due to COVID, understandably, we've been unable to be out at the various health boards, so that has allowed us to focus our attention on the communication, education and engagement arm of the programme. Therefore, I am very proud and excited to announce the launch of our Value in Health website. Next slide, please. This is where you will find more information about our programme, including our 3-year National Action Plan, case studies. You can read about our team's redeployment experiences and efforts in response to COVID, and most importantly, as mentioned, where you will be able to access the data dashboards that were launched this week, plus all of the recordings from our first Value in Health week. On that note, I would just like to thank our wider team, who you'll meet now, for all of their contributions to the website. And I'd specifically like to praise Moten Rayo, Mary and Bryony and Sally Cox for their commitment and dedication to achieve this in such a short space of time. I will now hand over to Sally, who will explain the key role that NWIS play for the programme. Thank you.
Thanks, Lowry. Hi, I'm Sally Cox. I work within the NHS Wales Informatics Service, and I'm going to tell you a little bit about NWIS today and our role within Value in Health. So I work with within the Information Services Department for NWIS, and I lead a team of 4 analysts, and we form part of the NWIS Value in Health team. So within NWIS, we have several roles within the Value in Health programme. So the information team's role is to support the programme through the development of information products and analysis, bring together nationally collected patient data with clinical outcome data, patient reported outcome data and financial costing data to inform a value-based approach to service transformation and sustainability. We have seen this week that we're on quite a journey to achieve this. However, the digitisation of services and joining up of local and national systems in recent years has enabled us access to more and more data sets and to provide a more complete picture of the patient's journey. So we've also started to make good progress in areas such as audit data collection and PROM collection and standardisation. This started with the issue of the Welsh Health Circular at the beginning of this year to mandate collection of this data within Wales. And although we were delayed due to COVID, we have now started the development of the first DSCN that will be issued to the health boards to detail requirements for submission nationally. We hold our first PROM standardisation stakeholder group next Thursday. So we've now produced 3 outcome data dashboards for clinicians, planners, and to support direct care service planning and quality improvement. These are the lung cancer, heart failure and knee arthroplasty dashboards. 2 of these have been released this week. And as Lowry said, they will now be available on the website at a high level for all in NHS Wales to access. We'll also provide a much more detailed view for those who require the access to the detail and to the patient data. So we'll be creating additional data dashboards in the months to come for more clinical areas and continue to work on the data acquisition and the data visualization developments guided by our clinical reference groups to evolve the dashboards into useful tools that produce reliable information and at the same time get our clinicians to realise the value of putting the data in at the start. NWIS have also been working on patient-level data visualizations to support direct patient care, showing an individual's PROM trajectory embedded into the patient electronic record. Heart failure and lung will be the first PROM visuals to go live later this month, and hip and knee will follow a month later. So another part of NWIS has also developed a technical means to capture PROMs data, utilising existing national NWIS architecture. And this allows practicing clinicians sorry, I'm not sure what this is. Right. Anyway, NWIS has also developed a technical means to capture PROMs data available to practicing clinicians, which allows the patients to fill in a solution in their own home before presenting to clinic using their own personal device. Questionnaires filled in by patients at home are visible by the clinician in the Welsh Clinical Portal. So in addition to all that, we have the National Data Resource, which is gaining momentum, which will have a huge impact on the Value in Health programme with regards to feeding the data dashboards. So now over to Lisa Powell, who's going to give an overview of the role of the Finance Delivery Unit within Value in Health. Thank you.
Lisa, you are on mute.
Sorry. Start again. So thanks, Sally, for that introduction there. Just a little bit about myself, Head of Finance Intelligence at the Finance Delivery Unit, a little bit about the Finance Delivery Unit, what our role is in the National Value Team and what projects we're currently involved in. So The Finance Delivery Unit was formally established in 2018. The new team was fully imposed by September 2018, and the unit is accountable to the Director of Finance of Health and Social Services at Welsh Government. So we're really pleased that one of the 4 pillars of work that we're involved in is to support the development of value-based care. And our director, Powell Jones, is on the National Steering Board, and it's also in that role supports the national programme, and Sally Lewis is the National Clinical Lead for Value in Wales. Also within the Finance Delivery Unit, we support individual health boards in the approach and delivery of value projects. So we offer on-the-ground support for local projects in line with the national priorities, and also are working to deliver a how-to guide and supporting information to provide some support to the local teams as well. So how does value fit in with our individual roles? Just a little bit to explain how this plays out in practice. So there's a lot of energy and excitement around the value programme within the Finance Delivery Unit, and all members of the Finance Delivery Unit actively participate in the value programme in some way, whether it's be as a senior lead and liaising with consultants or clinical reference groups, or in an analytical role and working with the data to tell the story and answer questions for the end user. In the previous presentation, Keith Howkins from NWIS mentioned earlier that the value work is breaking down some of the silos that we've traditionally got in healthcare. So it's really exciting to be part of this virtual team, because we work as a virtual value team across different organisations. So our team work very closely with Sally Cox's analytical value team in NWIS to try and understand the data, work with the PROMS team and also national clinical leads, and it's a completely new way of working, and really helpful and beneficial to understand the different aspects of the information that needs to feed into any value projects. So just briefly, what are we currently involved in? There's been some really fabulous presentations throughout the course of the week, and I've really enjoyed and learned a lot from all of them. One of them is the primary care Amantawi work that's taking place with a practice, the Amantawi GP practice, and there was a fabulous presentation by Dr. Duncan Williams and Dr. Sue Goodfellow on Tuesday, which talks about the groundbreaking work that they've been doing. The GP practice operates across 6 sites, but has had a deficit of GP sessions for several years, so they've developed a really distinctive multidisciplinary service model with only one GP partner, but lots of other clinical professionals like pharmacists, allied health professionals, and a triage system whereby patients will dial in and be pointed to the correct clinical professional to deal with their problem. And we've got the challenge and the really great job of trying to help work with them, be directed with by Sue Goodfellow and Duncan Williams to try and evidence the value of this practice compared to other more traditional practices. So that's a great piece of work. There's also the Improving Diabetes Outcomes for Patients in Wales, a project led by Dr. Sally Lewis and Dr. Julia Platt on Wednesday. And there's some exciting work taking place on that around looking at the adverse consequences of diabetes. One of our team is working with Mel Thomas, Dr. Mel Thomas, looking at the lymphedema pathway and inclusion of PROMs on that. And there was a great presentation on that earlier this week. And then some local work we're doing is a review of the Swansea Bay cataract pathway, which will be a very detailed piece of work, but then help to spread learning about how to understand the pathway, and then the lessons learned will be spread across other organisations. So the final thing I just wanted to mention is that within our team, Craig Davey, who is the Value Project Manager, has been developing a value finance toolkit, which I think will be of great practical help to health boards as they try and develop their local value programmes. So it's got lots of tools and techniques for measuring the use of resources at a patient, pathway or population level, and looks how you can start to link this data with the outcome information to give a rounder view of value. So a date for your diary. So just to mention this, the Value Finance Toolkit will be launched as part of the Finance Academy Value in Health series on the 3rd of November. And at this point, the toolkit will be made available for NHS Wales colleagues as a practical toolkit to help them through value projects in the future. So that concludes the information around the Finance Delivery Unit and our involvement in value. And I'd just like to pass over now to Kathleen Withers, who's the Principal Evaluation Specialist for Cedar. Thank you.
Thanks, Lisa. As Lisa said, my name is Kathleen Withers and I'm a healthcare scientist based at Cedar, which is an NHS academic research centre which is part of Cardiff and Vale UHB and Cardiff University. Cedar has been in existence since 1977, and since that time we've developed a wide range of expertise in areas including PROMS design and validation, service evaluation, systematic reviews, health economics and analysis of routinely collected and linked data. Our experience with PROMS started 10 years ago when we were asked to run a research study to develop and validate a PROM tool for use in patients with symptomatic cardiac arrhythmias. This work included the development and testing of the PROM, and we've now been collecting data with it for over 6 years. This has given a wealth of experience in all aspects of PROMS use, including the user experience and also the things that we need to consider when we're using the PROMS data itself. Although we're based in Cardiff, we work all across the UK and beyond with partners including the National Institute for Health and Care Excellence, NICE, who were the funders for the Cardiac PROMS project, and the Welsh Health Specialised Service Committee, and of course the Value in Health team. Within Cedar we have a small team of staff comprising of myself and Dr. Rob Palmer, who you may have seen earlier this morning giving a really helpful talk about the things to consider when undertaking PROMS analysis, and we are dedicated to supporting the Value in Health programme. Our rules on the programme include gaining national licences for the PROMS tools that we are using on the national platform in Wales, and leading the Welsh language translation and validation of these. We also support qualitative data capture within the programme, such as facilitating focus groups and patient and clinician interviews. These can help us to gain insight into the impact of interventions, such as service redesigns from different perspectives, and importantly, to make sure that we keep patients involved and at the heart of everything that we're doing. However, our primary role in the programme is providing additional analytical capacity to the Value in Health team, utilising a wide range of available data sets. This work differs from the type of analysis that is being led at NWIS, which is producing the fantastic data dashboards that we've been seeing throughout the week. We are very much focused on bespoke pieces of analysis, which are individually tailored and may range from complex analysis of large linked data sets to analysis of small, locally collated data sets. The The outputs of these can also be customised in their design and the level of detail provided. So, for example, we can provide simple slides with graphics for presentations, or we can provide highly detailed in-depth reports at the other end of the spectrum. These outputs can be used to help answer specific research questions, to get a better understanding of the impact of an intervention, or to identify trends and patterns. You may have seen a few examples of our work over the week, including in today's presentation of the National Joint Registry Knee Outcomes Data by Dr. Phil Thomas, which compared the outcomes of patients with different types of knee implants. Similarly, we've carried out analysis on PROMS data collected from patients receiving hip or knee replacement surgery at Betsy Cadwallader UHB. For this patient cohort, we've been able to compare the outcomes of those patients who have attended joint school and those who haven't. Other ongoing analysis work includes looking at the PROMS data from patients pre and post cataract surgery. Although the national PROMS dataset isn't yet mature enough to base high-level decisions on, it has the potential to help us understand how different treatment options and patient demographics like age and gender can affect outcomes, and it can also help us to understand how variables such as patient BMI and lifestyle factors, including smoking and level of exercise, can impact baseline quality of life. And we're looking forward to playing a part in this important work. As you may have heard from presentations earlier in the week, we're also working with Dr. Karen Pardy and Dr. Sue Goodfellow, supporting their evaluation of the Cardiff Southwest Primary Care Cluster Transformation Project. For this, we will be helping out with interviews with a range of staff and patients so that we can identify the impacts of the changes that have been implemented, and also to try and find out what further improvements can be made. As a team separate to the provider organisation, we can offer a more independent approach, which can be helpful in making sure we gather both positive and negative feedback for an unbiased evaluation. We're really keen to support partnership working, both with colleagues in Wales and further afield, and as well as working on projects with colleagues in primary and secondary care in NHS Wales. We're also currently collaborating with academic and industry groups and colleagues in NHS England. The support that we can provide includes developing statistical analysis plans, undertaking data analysis projects, service evaluation, literature reviews, developing conference presentations and publications, PROMS licensing advice and grant applications. If you've got any projects that you think would be of interest to the Value in Health team that you would like to collaborate on, we'd really love to hear of you, so please get in touch. I'd like to hand you over now to James in the procurement team so he can tell you a little bit more about their role.
Thank you, Kathleen. So my name's James Griffiths from the Value-Based Procurement team. I work with Niall Saunders, a project manager, Leanne Bale, project officer, and we report into Andy Smallwood, who you may have seen in previous presentations, the Assistant Director of Procurement. So we're now in what we deem to be an acceleration phase where momentum is building, and we're looking to promote further adoption of value-based procurement through our frontline and central sourcing teams with a view to value-based procurement becoming business as usual. We're keen to engage with industry around the 3 Ps of our value framework, namely product, process, and the 3rd P of patient. And this is particularly perhaps the most interesting area, and we're really looking to forge ahead now in terms of patient-centered decision making and bringing the patient outcomes and experience to the heart of the procurement decision making process. We're also beginning to work within a 4th P, which is emerging, the 4th P of person, sort of linked to socio-economic factors of procurement decision making, with wider links to the wealth and health of the population of Wales. So to achieve our aims, we've established a community of practice which links procurement teams from across NHS Wales, and our objective is to embed through that community of practice a common language and an understanding, as well as providing a platform for sharing both good and bad practice and kind of learning from it. So we're very keen to engage with industry around that area. I suppose if I could offer a takeaway message, NHS Wales sort of VBP momentum is certainly building, as you've seen through this week, and we're already thinking differently about procurement, moving away from price-centered negotiations to one of putting patient at the centre. And so if you want to join us, please feel free to email me and the team at vbp@wales.nhs.uk. That's vbp@wales.nhs.uk, and the email will be shared with you after this. So I'd now like to hand over to Dee of the Life Science Hub.
So good afternoon, everyone. My name is Dee Puckett. I'm the Head of Health and Care Engagement at the Life Science Hub Wales. I'm also the Senior Lead for Value-Based Healthcare. And unlike my colleagues on this team session, the Life Science Hub Wales are the new kids on the block. So we just wanted to give you just a quick introduction to us in relation to value-based healthcare. Next slide, please. So the Life Science Hub Wales is a wholly owned subsidiary of Welsh Government. So we are completely funded to support health and social care across Wales by identifying the key challenges and working innovatively with industry in the life sciences sector. Next slide. So we drive innovation by creating connections with industry across the life science sector, building consortia, and really listening to the challenges that are coming up right the way across health and social care. Our 5 key areas that have been identified as part of our business plan around healthy ageing, value-based healthcare, digital AI and robotics, precision medicine, and advanced therapeutic medicinal products. Next slide, please. So you've heard all week from health, from the national team, from academia, from procurement, finance delivery unit, and shared services. And much of the work has been going on across health. And some work has been undertaken with industry, but we've really now been brought in to help drive Goal 5 and Goal 6 in the action plan. So really developing that research with industry, being able to enable consistent terminology, those collaborative innovation projects that are really going to be able to move this forward and move the conversation forward and look at how procurement in the future can actually take place with industry as a partner. So part of our work, next slide please, is really bringing forward now where industry are, where the baseline are. So this week we've hosted a number of sessions. So we partnered with Health Technology Wales and brought 2 training sessions that we normally deliver in person. The first one on health economics, the second one on health tech appraisal, to really start to build those skills and understanding right the way through different levels of industry, from SMEs up to global companies. And actually this week we've had over 70 companies join us, over 200 employees, and it's really demonstrated a real interest and passion for getting involved. And part of the work that we're going to be doing is working with the team that are on this session, that have been working so hard already, to identify how we can best support industry. So we are going to be looking at developing an industry toolkit. So much like James has mentioned around the one for health and how that will support the discussions internally, we need to be able to make sure that the same conversations, the same understanding can actually take place to really drive those joint working projects. We do lead and support a number of joint working projects across Wales between health and industry, and we're really keen to make sure that they are aligning to the data collection and the analysis that can take place. So they're really considering at the point of joint working agreement how those PROMs and PREMs and clinical outcomes can really be used to demonstrate evidence and effectiveness. We're also, we will be looking at an international conference next year. We will be hosting tomorrow's health conference in March, right across our 5 key theme areas. So you haven't heard the last of us. Also, as many of you may have seen, and I know you signed up to, we gave you the opportunity to identify if you'd be interested in being part of a specialist interest group across value-based healthcare. And the response has been phenomenal. So across the teams, we will be getting together post-event to look at how we can best pull that together with the numbers and with the interest we've got. So we'll be sending out some more information about that as well. So without further ado, next slide has just got some contact details on for you. So if you are working in industry and you are keen to get involved, please do contact us. You can do it on the website or by all of these social media elements as well, or please email me directly. I'd like to hand over to Dr. Sally Lewis, our final speaker of the whole week. I'd like to say thank you to everyone that's been involved. in front of the camera, behind the camera. It really has been a joint team effort, and for everybody for participating. Sally, over to you.
Thank you, Dee. And well, we've finally reached the end of a whirlwind week. And all that's left for me to do is to close off the conference. But before I do, some thanks first of all. I need to give a special mention to Priya, Alistair and John, our editors, who I think have done an absolutely amazing job at staging this virtual event. As has been said, it's the first time we've done anything like this, and I thought it went really smoothly. We couldn't have done it without you, so thank you, thank you. Question and answer support, our very own Amanda, Sarah, Lowry, Sally, Kathleen and Jonathan. And I want to give a special mention, if I may, to Sarah Pantoni. You haven't seen her this week, but she's been working tirelessly behind the scenes, and there's no way that we could have put this on without Sarah's efforts, particularly around organising the speakers and their briefs. I'd also like to mention Adele Carhill and Emma Wilkins, other key members of the team who haven't presented this week, but do so much to support the programme. And also Denise, Dorney and the comms at Life Sciences Hub, and to Carrie Ann for sponsoring it. And of course, all those involved with the Value in Health website. I think my final reflection about this week has already been touched upon by Lisa earlier in this session. What's special about this programme is the way that it's brought together people from all disciplines across the healthcare system and patients as well. So it doesn't matter where you are working within the healthcare system in Wales, there's something in it for you in Value in Health Week. And surely we won't achieve anything in healthcare, whether it's better outcomes or sustainability, if we don't work together and find ways to break down the silos between all of our disciplines. So thank you very much for joining. Hope you've enjoyed it. We certainly have, and we'll definitely be doing it again. And don't forget, recordings will be appearing on our new website in the next couple of weeks. See you again soon.